Incomplete lip. Don't even think you had a major opening up. You've not had a major clefting, so maybe it should not be like that. Because if there is a complete clefting, then the effect will go all the way in.
I don't have that.
So even the scan's not there. So then it's not like it's not going to be that good. I can give it symmetrical.
Okay. And so this side of the profile, if you can see, so a lot of people have told me that I look a little scarier from this side. Like even if that's not how I am as a person, but
so listen, this is mainly because of the lip and the nasal columnar angle. And again, when you look at the side, even this comes to play. This side is more better than this side. Even the angle, if you see carefully, like you see this, or see this, everything is slightly different. This is a little different. This is a little different. This scar is visible. That's why they're saying the difference. Can't get you 100% that. You make it better.
The nose, I'm saying what all would be done. Like you'll become.
So hump will go off, will get more feminine. Your nose is now too pointy, too bulbous, and slightly deviated tip. That will correct.
And the tip won't be too droopy also, right? When I smile,
No.
it shouldn't.
No.
Okay.
We're better than this. I don't think we should do much on the symmetry. It's pretty symmetrical, the LR base.
Okay, LR is fine, but I think it's still like it can be reduced a little
Bit.
You can just.
I mean, I can do.
And that the thing that you mentioned about the columnar angle, I think that angle thing should also be corrected a little.
Angle thing I'll correct, but then the only thing which might be a little bit of an issue is the tip pointiness. I will make it pointier than this, but because it's a revision, I won't be able to comment. And also I might need to put a rib in between to get that projection forwards. I have already mentioned to you.
But it won't be too big also, right? The nose if you put the rib.
The rib is not to make the nose bigger, Baba. It's in your case, it's because the earlier cartilage has all been taken use of by the earlier surgeon. Sometimes I'm not able to use it again to that bolstering to bolster it because it's revision. If it's primary in your case, I would not have needed it. But because it's revision, again I may not need it. There's a good chance I don't need it, but just in case it's needed.
Before my previous surgery, right, I had a droopy nose and that was taken out, but I was left with this bump.
That will go away.
That will never come, right? Because that came back after 1 month and I was just thinking,
how can it come back after a month?
So there was swelling and all, so nothing was visible, it looked straight.
That's the reason why we take videos, so you can see that on the table also. Really, many patients think that 6 month, 4 month, 3 month results are the best. I agree with them. But what many patients also think is on-table result is not genuine, but that's wrong. What is there on table usually tends to come a little later. One thing. And secondly, you also get an idea what was there on the table actually, right? Because once the swelling catches up, nobody can imagine what was there on the table. So then the swelling comes like a mask to cover the actual work done.
And how much time will it take for the swelling to go? At least for me to return to work.
If you're working from home, you can work from day 3. If you're going to some office location, give it some couple of weeks at least. At least. Minimum. 4 hafta bhi better.
I have to go to office. I'm on leave till 30th of this month. So first December I can request them for work from home.
That's perfect.
Yeah.
You can work from home in 3 days, I said. So then they'll be happy. You say, I'm fine, I can work from home if you want me to work.
These are my mandatory leaves, I don't want to waste it anyway. So I'll take it either way.
Yeah, sounds good. That is
also,
fun.
when I smile, it like notice I think this my gum like this thing is visible only on this side of the.
That big cut after doing it. There's no problem with your teeth. Smile. Nothing. Your teeth are nice. Thumbs are nice. Because the movement of the lip is different, and that's why there's more tooth show on the left side. Once we revise, that's going to go away. Should go away. See, yours is very fine, subtle work, right? And very fine, subtle revision work. Now, 90% I'll be able to give you for sure improvement as in, but 90 to 100% depends on a lot of factors. like what was done before, all the muscles in the place. Do I get to mold the lower lateral cartilage? Many technical issues. So that's why it's like that. But definitely there'll be good improvement because see, this is something that's like absolutely not on. The tip is like not this thing, it will be narrow, this is thick. So all of those major issues put down will finish.
And overall also like I am very much like my mom. She also has thinner lips. I can see my lower lip is also thin. So will I get any volume in the upper lip like which will match my lower lip?
So right now we are not planning to improve or increase or decrease your lip thickness. I can increase if you want. You can decrease also if you want. We are not doing that right now. Right now our goal is to just move the muscles and put it in the right place so that to give your lip what it should have been in the first place, but it is not. So that's the goal. After that, after 6 months, once we achieve it now, once it heals for a few months, then if you want to make it a little bit more thinner, we can do it. But not
require surgery?
Yes, I do by surgery because that's permanent. If you want to give fillers, you give fillers. That we can get another surgeon. But I prefer, and this is the way that.
But no fat grafting?
No fat grafting will be, no. Not now, not later, for clear. You are not needed. We can manage with the muscles by moving it in the right position. I'll get it. Even now I can see these muscles are all extra and this is short. So it's like I just switch them around and that will be able to do it.
Also there's some fat which is like just like inserted here, you see, that's still there, that makes it look like a V shape was created and fat was just put there.
But part of the fat has disappeared and that's why the notching is again come back, that's why the asymmetry. That's something that happens with fat. Alright, so see you tomorrow.
Yeah, thank you so much.
You're welcome. Bye.
Do I need to like take anything? The papers?
No, nothing for the moment. Just see tomorrow. I'm going to make entries here about our discussion and some fine points, and then.
Okay. Done. Yeah.
Bye bye. Subtle lip revision to mainly improve the shape of the lip. There is some swelling on the lateral aspect, as you can see. And thereafter, we're going to be moving on to the nose. There's a small hump there. There's asymmetry on the tip. And we're going to work on the alar base as well. There's a slight asymmetry. I'll show you that now from this view. So the left side is broader. The tip is a little bit to the right, as you can see in this view. So those are all the concerns of the patient that we're going to try and address. And that's a revision rhinoplasty. You can see that from the scar there. Reconstructive cosmetic cleft revision rhinoplasty. So that was how the nose was. You can see the hump, the tip was drooping down, and there was asymmetry. We're going to show that also. So now it's corrected. So you can see the deviation.
Is it hurting? No, right? It's pretty. Look up. One second. All right. Come, we can. Do you have a mirror with you? It's right here, Rose. It's on the table. A little bit of this. These are all just small pimple type of a thing. So let me show you the side views. Look at that. Yeah, there is swelling everywhere, but if you see the shape of the nose, can you see that? To the earlier, there was a hump, the tip was broad and it was over projected.
Now the hump would come back, no? Like last time also, when the nose was out.
No, where's the hump? No, look here, where's the hump? It won't grow again, it's not like a horn. It's gone. Yeah, it's going to just go in by 1 or 2 millimeters. It's just a straight, beautiful line now. And this is just narrowed also. And you can see here how clearly the hump was. It was like a wavy thing. That's gone. It's not going to come back again. I know you told me the last surgeon did it and you got it back. But it's not going to come back anymore. And then this side, again the hump is gone. And of course, there's still swelling everywhere, you know. That's where you can see some small dot of blood coming there. There's discoloration. But the overall shape is much nicer.
I see the stitches are starting from here. There's nothing done over here. And this is exact line over there from the last surgery.
Correct.
Why did we not touch that?
Because I did it from inside. If you lift your lip up and see, you can see the scars going in.
This scar.
Now look here.
Yeah.
So the muscle that needed to come, the mismatch was more in the 1 centimeter around the tip of the lip, vermilion as we call. So that's why I didn't do it on the alar base. And second thing is we're doing a rhinoplasty there. So we're anyway going to open up the nose. So you shouldn't try and put incisions too close to the same area. It'll affect.
So from this side, if you see, because it goes a little inside at this angle.
Yeah, I think that is because your nose, there was asymmetry, remember? That asymmetry is going to show like that for a while. The lip is going to look fine, I'm sure. See? This width, which is more, and you know also the shape has been narrowed now.
There is a lot of swelling inside my
Yeah. Because we've done a lot of septal work. And it's a revision work, so there's a lot of swelling still. But just look up a little bit, and you can already see that this swelling is not there now. It's more like a lip that's going to get to a Cupid's bow kind of a look now. So here is going to be more protrusive than that, and then it's going to be gradually slimming down. It will improve much more because, you know, one, it's a revision procedure, and two, it's a very fine thing that we have done. And there is improvement as I see it, but there's still also a lot of edema. It'll take a while for all of that to go down. And you can see even the earlier that notching kind of a thing, you won't have anything like that now. I've revised all of that.
So once the swelling goes down, it will go down from everywhere.
And don't worry, the hump will never come again. So
After
this side.
will the swelling go down from everywhere? Will the
Yes.
shape retain like this?
The shape will be the same, but it'll go down from everywhere. Yeah. All that can happen is, see, if you look carefully, it can just go down a little bit more
From here.
from there. That will only look nice because you're a girl. It's not going to come up anywhere because this is already the swelling that is visible. Show the side view, Rose. I think that's where the other side.
It's all dead skin.
Yeah, because we put that'll go away. You don't do anything to it. Just give it some time. Dead skin because of.
Now my chin also looks in proportion as compared to earlier, right?
Correct. Definitely.
Have you done anything to this window as well?
Yes, I have. I've done we remember we discussed. I also told you that this thing is not looking so nice. So the scar, all of that also has been done. Can you see the difference? That's called the columnar-alar relationship. This is columnar, this is alar. That relationship also is better now. It was looking more towards up.
Yeah.
And you were like, I don't like that. And then the nose is... So all your concerns I've tried to do. And I would think we've achieved 90%. Okay, because it's a revision and because it's a cleft and because it's a minimal one. Sometimes 100% is a little difficult. Some areas 100%. Some areas maybe 90%. Hump and all 100%. It will come out very well here. The nose size also will be a little bit nicer only now. It's narrower than before. But maybe this area will be a little bit thicker. I mean, if it was thinner, it would have been even better for you. But I think I've managed to get only
How much swelling would be here? Like
2 millimeters. But I'm thinking even after the swelling goes, maybe thoda sa you will think that it is a little thicker. Maybe. Just something I'm guessing. Anyway, give it enough time and it should be good. Give it 4 weeks, okay? Because remember, these two small dots are because of the osteotomy. Done quite a lot of bony work, both at the dorsum, also at the side. And because of the bruising, only the slight discoloration that you still see.
And how much time will the discoloration?
4 weeks max. Sometimes as early as 2 to 3 weeks. So no dietary problem for you. Okay, eat what you like, and there are some pimples also there if you see.
Yeah.
That's not very nice. We'll give you an ointment that you can apply on top so those pimples don't cause any.
These sutures will be taken out, right?
Yeah, everything, all sutures will be removed today.
Nose also has internal sutures?
Yes, but nothing will be touched. And that you will also not remove. Nobody will remove that. It will be there for maybe a month or a little longer. It stays. Don't try to remove that. All right? Take care.